I'm Cameron Watt, Chief Executive of the Northern Ireland Federation of Housing Associations, and we're here at Crumlin Road Jail where we've been having our Supporting People conference towards 2020. And really we're looking at the whole range of housing, care and support services that housing associations and managing partners provide to help people live with as much independence and dignity as possible in the community. And that whole housing, care and support offer is sustained through the Supporting People programme, which is funded by DSD and managed by the Housing Executive. And that helps about 20,000 people annually, whether it's frail older people, people with dementia, homeless people, or people with learning and physical disabilities. So it's enabling a huge range of people with particular needs to live independently. We appreciate that there are major funding pressures at the moment, and we need to ensure that every pound of public money is going as far as possible. And so at today's conference we were discussing with DSD, the Housing Executive and the Health and Social Care Board how we can reform Supporting People to make it even more effective and ensure that we were able to make the case for continued investment in these key services over the next 5 years. New research has shown that for every pound invested in supporting people in Northern Ireland, it saves £1.90 through reducing the need for other public services, whether it's health and social care or criminal justice or whatever. So there's a really compelling invest to save argument. Supporting People has a key role in fulfilling the likes of the Transforming Your Care agenda, helping people to move out of acute hospitals and to live in the community for longer. So we believe that housing, care and support offer, it does have a crucial role, and we need to make the case with partners to sustain the investment and reform and refine services so that we can deliver even more over the next 5 years.
Where do you see care and support going over the next 5 years?
I think there'll be a bigger emphasis on helping people regardless of the type and tenure of their accommodation. In the past, a lot of services have been accommodation based, and I think one of the messages of today's conference is that we need to ensure that services are available to everyone regardless of the tenure of their home. We know that there are many more older people coming through who are going to be homeowners, and as housing associations we need to develop a housing, care and support offer that provides something for them, whether it's floating support to enable them to remain in the family home for longer, or potentially some sort of potentially retirement village option where they can buy their own home in a specially designed community, but have access to care and support that they might buy in as and when they need it. So I think there are some really exciting opportunities. There are opportunities around reablement, helping people to get out of acute care for example, after a hospital stay. I think there are also opportunities around end of life. We know that lots of people end their lives in hospitals when they'd much rather be in their own home or in a hospice, and I think housing associations can work more closely with health trusts and the hospice movement to provide a care and support offer for people at the end of their lives. So there are big opportunities but big challenges, and I think that working with those partners we can really ensure that the Supporting People programme is increasingly effective and relevant and providing some innovative answers to these key challenges.